Good afternoon, everybody, and welcome to this, which is the third public meeting of the NHS Commissioning Board Authority. I would very much like to welcome those members of the public who have joined us. You're warmly welcome to this meeting, and I'll say in a moment a few words about how we will be conducting the business of the authority. Before I do so, I would like to welcome new members of the board, in particular Jane Cumming, who has recently been appointed as the Chief Nursing Officer for the board, and also joining us today in person, Ed Smith, who on the last occasion joined us by video conferencing, and Ian Dalton, who is sitting over there, who is one of our new national directors. This is, I think, a very important meeting for the board because it takes place following the completion of the parliamentary processes of the Health and Social Care Bill, which is now formally legislation. But let me put that into context. First of all, the bill will create a new commissioning board for England, and the body assembled here today is the interim commissioning board authority. The current intention of the Secretary of State is that from the 1st of October, this body will morph into the new body, and the new commissioning board will be fully set up in law, and it will from the 1st of October start its new responsibilities in relation to the authorization of CCGs, clinical commissioning groups. However, it will not take on its full range of new legal responsibilities until the 1st of April next year. So we're in a transitional period with staged implementation of the legislation into full effect from April next year. So the authority has been keen to start out in the way in which we propose that the board will continue, which is an attitude of openness and accountability and transparency for our meetings. To hold meetings in public is a novel experiment, but it's one to which all members of the board are committed. And not only is the meeting being held in public today, but it is being live web streamed, and for those with a particularly obsessive cast of mind, can be viewed many times on our website hereafter. But that's important. We do owe it to the public and to patients and families and carers to ensure that the decisions that we take on this board around the future ambitions and aspirations and implementation for the provision of healthcare in England are taken in a manner which is open and accountable and transparent. I did say, of course, that this was a meeting of the board in public, but that doesn't mean it's a public meeting. We're delighted to have public with us today, both digitally and in the flesh, but this is a meeting of the board, and the business to be transacted is business of the board. We will not be taking questions or discussion from the public, but we will, of course, at the end of the meeting, be willing to engage informally with those who have joined us today. So I hope that that opportunity will present itself. I should also stress that the board operates through different means as well as these public meetings. Every time we meet in public, we will also have a meeting on reserved business, which will take place in private. Reserved business tends to be that which has some sort of commercial element, or which is confidential for other reasons, perhaps involving intergovernmental relations. Secondly, we have been extensively involving all members of the board, including the non-executive directors, in workshops with the executive directors and with other members of the team to try to ensure that this board works as a team. It's joined together, it's working together against strategic objectives which it's determined to deliver. And those sessions allow the non-executive directors to become as acquainted as they can be with the detail of the board's business which is being undertaken by the executive national directors and their staff. So forgive us if I say that we are still working on our ways of working. We want this to be a different style of working. We want this to be a new stage in the development of the NHS in England. And we will continue to do things which we hope will advance that cause. We will hold meetings in different venues. We will continue to ensure that our publications are clear and simple and strategic, and that we're able to communicate as well as we can what are some of the exceptionally significant changes in the way in which healthcare is to be delivered in England, following the passage of the Health and Social Care Act and leading through to a new pattern of delivery over the coming years. This is a truly challenging project. There is an enormous amount to do, and as the papers that will be debated this afternoon demonstrate, we are fully conversant with the challenges and with the risks and the ways in which they need most appropriately to be managed. We, as a board, are totally dedicated to ensuring that we maintain the fundamental values of the NHS as particularly enshrined in the NHS Constitution, and that we are committed equally to bringing about, through these new structures, real and measurable benefits to patients, their families and carers.